Guys, this is Greg Purdy. I'm going to give you my PowerPoint presentation that guys, this is Greg Purdy. I'm present to you my PowerPoint on my written community plan for this class. So, not very good at PowerPoints. It's not very fancy. I think the content is good, and I'm not sure about the sound. I'm going to work with that. I think I can do this. I've never had to do this before, so hang in there. We'll get through it. My written community plan, of course, written by Greg Purdy, student at Herzing University, for nursing 474-8B community health nursing class. And Professor Dolores Merritt has been our instructor. Today is actually, I'll have to change that date, is actually December 15th. So let me move on here, see if it will stay with me. Okay, I have to stop the sound and do it every time, and that's okay. Okay, so we are going to talk about this is my introduction. The purpose of this paper is to provide the reader with a detailed description of a small mountain community located in the foothills of the Cascade Mountains, western Washington state. You will be provided with a definition of a community, includes a windshield survey assessment, available resources for the residents to enjoy, including overall condition of the resources, a formal nursing diagnosis, which concerns a distinct population within the community, will be presented that correlates to the clinical component for this course. There will be a detailed accounting of certain activities and interventions that have been instituted by moi to counteract the deficiencies that are noted by the diagnosis that I did. The information will be included to identify the residents who will benefit from this interaction that have the potential to enhance the quality of their lives. A formal summarizing conclusion will then be provided that will remind the reader what has been presented about this community and its residents. An appendix is attached that will provide the statistical data that is relevant to the beneficiaries of the determined clinical interventions. That's a mouthful. But anyhow, what am I going to do that's going to help them? The listing of all references that have been utilized for this project will be included, and this will provide a detailed description of the resources necessary for obtaining the information that has been presented. Sorry. Okay. So we're going to stop it there. So this slide is the definition of community. This community is located on the eastern base of the scenic Cascade Mountain Range, Ellensburg, Washington. The town's name is situated within the Kittitas County and currently has about 22,000 residents, which are 81.9% Caucasian. All the statistics thus far will be supplied by citydata.com. This town has a growth rate of 2.5% annually. The largest employer is Central Washington University, 25.8% population employed there. City limits are only 608 square miles, very small town. The average household income here is about $49,500, which equates to a poverty rate of 32.5%. The city operates and maintains basic utilities such as water, electricity that provide a comfortable and safe environment that the residents can enjoy and build upon. A variety of restaurants offer delicious alternatives to preparing your meals at home. Several local breweries provide a source for their crafts. Okay, the next slide will be the windshield survey that I completed. You all did one, so it was pretty good. This section of the report will explain particular resources. Um, this thing is um, this section of the report. I don't know why it has to do that. So this slide will show you the windshield survey that I completed. You guys all did one, so it was a lot of fun. But, broken into certain sections. I will begin with resources. This section of the report explains particular resources that are available for the community, general condition of the equipment, overview of the natural environment. Within the limits of the city, residents can choose from several grocery stores, a wide variety of local restaurants or fast food choices, which offer convenience and portability for the busy individual. Kittitas Valley Health is the local hospital that is located here. It's where I'm working to provide for the medical needs of the residents. And it is the third largest employer at 6%. There again, all of our statistical data thus far is going to be supplied by city data. Services available at the hospital include the emergency department for acute situations, the family birthing, the family birthing center, and an efficient, hoorah, surgical team provide a place of respite. General medical needs such as dental care, dermatology, dialysis, optometry, medical clinics of various types are all represented well and available to the local residences. Our next section will be residences and roads. Many of the neighborhoods are comprised of small, well-organized single-family residences, although there are an extensive amount of apartment complexes to offer a temporary and cost-effective dwelling, and these are mainly for the CWU students. The general conditions of the streets and roads is good. Sidewalks are available to provide a safe way for pedestrians to travel. The town has 4 high schools, 5 elementary schools, and these are for, of course, the younger generations, and the general condition of the recreational equipment appears to be in good repair. Moving on, our next section will be religious and social organizations. There are several spiritual organizations who offer services to the community. However, believe this, over 70% of the population do not claim any religious association. The Catholic religion will encompass the largest percentage of residents who do actually attend with some regularity, and that's 11.7%. Evangelical Protestant faith has a following of 8.4%. Many of the church buildings do not appear to follow a consistent maintenance schedule, well, with low membership, and this is simply due to a lack of funding by the parishioners. So recreational facilities One of the most appealing characteristics of this town is the abundance of outdoor activities which are made available utilizing any one of the 22 recreational areas and parks. That statistic was provided by Ellensburg Downtown Organization .com .org. I'm sorry. Several of these very well maintained facilities actually include indoor amenities, things such as fitness equipment, heated swimming pools, so they can be enjoyed when the weather turns colder, as it is now, 24. Is one local nursing home to provide for the geriatric residents. This will be a place for social interaction, exercise, cultural activities, as well as any graduated medical care that they may require. There is also a community center here that can be used for social gatherings. Group meetings are available by reserving a time. This facility appears to be well maintained and frequently used, except during COVID, but you know what I mean. So my overall analysis is that the town seems to be environmentally responsible. This is evidenced by the recycling efforts they make and is very clean, very trash-free public areas. There is an abundance of outdoor activities and recreational areas that promote a healthy lifestyle and provide an opportunity for mental clarity, which we could all use. The people that I have encountered here have been very welcoming and genuine, which are not characteristics that are automatically provided different places I've traveled. So one major challenge that I see for many of the residents here is the lack of employment prospects, leading to the 33% percentage poverty rate. So our next slide will show you our community assessment. This breaks down to several different areas: demographics, health status, and healthcare providers. A little bit more detail. So what we have demographics, and I'm utilizing the 2017 census from Citibank website. Total population of Ellensburg was 20,326. This number includes 9,861 males, 48%, and 10,456 females, 51%. All of the statistical data, most of it on this slide, and I'll indicate where it's not, is given by city data. So, even though the overwhelming majority of the population here is white alone, 81%, 15,000 people, there's still much racial diversity, but in very small quantities, as you can imagine. The next large group of residents consider themselves to be Hispanic in origin. There's 2,300 of those. Two or more races would be 1,023. Asian alone, 616. Black alone, 398. Native Hawaiian or other Pacific Islander, there are 90 of those. American Indian alone, 38. So, pretty diverse. According to the research that I looked up, several distinct ancestries are represented also in this community, which adds to the unique culture that the residents enjoy. And these will be proportionally the leading lineage, is German, 13%, English, 9%, European, another 9%, a little bit smaller, American 7%, Irish 4%, and rounding up the course would be Norwegian at 2.9%. So pretty interesting breakdown there. Let's talk about the health status of people living here. Since there is a university campus, the median age is 24 years, and the majority of the residents are generally in good health. We all are at that age. Um, Only one of every 4 individuals would be considered to be obese, and this is determined by an average body mass index of 27. And the body mass index, I know you guys know it, calculation based on height and weight ratio. That information was supplied by WebMD.com. So this community does offer a great amount of well-kept recreational areas. I think we talked about those earlier. That allow the residents an active participation in maintaining their health status. The state of Washington has actually started a statewide initiative that is focused on the physical and mental health of its residents to encourage them to remain healthy throughout their lifetime. That information is provided by the Kittitas County Public Health website. So some of the main some of the main areas this plan will focus on, or does focus on, are substance abuse, which unfortunately we see all over, emotional wellness, that again has been elevated due to COVID, and they also are going to focus on preventative treatments that will hopefully help to avoid prolonged poor health conditions, chronic things that we see. So despite these measures, there does remain a huge impact to the economy of the whole entire state from chronic medical conditions that incur a loss of productivity. These individuals are not working, and of course the increased medical costs. Now the major contributors here will be very familiar with these: cancers, heart disease, and stroke, all of which unfortunately are expected to rise due to an aging population. So the next thing we will talk about will be healthcare providers. Kittitas Valley Health, it's a community hospital located here, and that's where I'm working, that they offer 24-hour medical services, emergency services. They can provide critical assistance for any acute injury. However, major traumas will need to be transported to a large facility, roughly 2 hours away in Spokane or something. So the hospital does house a fully staffed medical team at the Family Birthing Center, and they will provide local expectant families the care that is necessary in a positive and professional setting. The surgery department, hoorah, at KVH is available on call 24 hours a day, and to provide the medical team, the medical needs of the residents. Both inpatient and outpatient surgeries are performed there. Highly skilled, qualified, competent staff, and they are led by some of the area's leading surgeons. Excuse me. The KVH system includes many satellite clinics throughout the upper and lower county so that services may be provided to remote clients who are in need of care. And these clinical offers are quite extensive to find so that the patients are able to find the appropriate care that they require. Okay, so this next slide is going to be our actual formal nursing diagnosis. As you all know, there's a little bit of a process that we have to go through to get it. Up on the board, you see it, but I'll walk through the steps are required. So, to address the needs of one component of this population, a nursing diagnosis has been established that will provide a focus for the interactions which are intended to alleviate those conditions. To accomplish this, there needed to be a defined health risk to the community, which has determined, to be impaired nutritional status. The next step was to identify the specific individuals within the community who will be the recipients of this assistance that I'm offering, and those, excuse me, will be the Kittitas County residents. So the final component of this process is to make the determination of why these particular members of the community actually require assistance. And now I have identified this as poor nutrition and financial impairment. So one other aspect of this diagnosis is to determine the goals and objectives with some reference to a time frame where this will be accomplished. And I have said within 4 months. So I think that's ample enough time to be re-educated if you're going to get it. After completing the steps of the process, our nursing diagnosis has been formally submitted as, read along if you'd like, risk of impaired nutritional status among Kittitas County residents related to a knowledge deficit which is evidenced by poor nutrition and impaired finances. Oh. This slide will show the objectives of the actual project that I've chosen to do, and we'll talk about that a little bit now. So the objectives for this project were based on the needs of the local population in Kittitas County, with a current poverty rate of 33%. That's given provided by homefacts.com. And a relatively high unemployment rate of 9.9%, which is extremely high, even considering the state of Washington. These two facts alone indicate the substantial deficit many individuals face in regards to the amount of funds required to adequately provide healthy food for a family. You can imagine. Understanding this, the clinical project objectives that I chose will seek to alleviate some of this deficiency, and I also want to provide an educational component that will allow clients to make sound nutritional choices, hopefully improving their quality of life. Therefore, the stated goal will be the families and individuals living in Kittitas County will be educated about proper nutrition and available resources to provide a balanced diet for no cost. Hot meals will be provided to individuals that are unable to provide for themselves. So, going forward, the organization that I have partnered with is called FISH, which is I think it's an acronym, you could say, Friends in Service to Humanity. They are a faith-based organization established in 1971, and they have the goal of giving Kittitas County residents a source of nutritious and necessary food, and the mission statement actually says, I'll quote, a community building partner showing the love of Christ by connecting our neighbors to food, resources, and hope. It's pretty strong, and that was provided by the FISH website. So local grocery outlets are a fantastic source of donated items that include fresh produce, dairy, non-perishables, and meats, helping to ensure that well-balanced and nutritional items will be available. With the help of volunteers, um, fish employees spend several mornings each week retrieving these items, which are then from the grocery stores, which are then sorted and organized by category. Proper care must be taken during this process to ensure the integrity of the packaging is kept intact so the food can remain undamaged and appealing to the client shoppers. That totally makes sense. Large walk-in coolers are able to house the refrigerated items so the quality is maintained until consumption. So clientele, let's talk a little bit about that. The distribution center, or pantry we call it, is open for certain hours each day, each weekday, to allow the residents the opportunity to make their choices of the food that is available. Normally, each client is able to shop twice per month and determine what items they will be able to consume prior to the next visit. They normally choose between 85 and 100 pounds of food each visit. That's a pretty good amount. The choices do include several offerings which may be indicated as dietary staples for any of the diverse cultures that, as we learned earlier, is very diverse. So we try to provide certain foods that would be appealing to them as well. This next slide will talk about the actual clinical component that I chose and kind of detail that out for you a little bit. So one of the requirements of this course, of course, as you all know, the completion of a clinical project, 45-hour stipulation associated with it. Each student must establish an objective, build a relationship with a community resource, and provide documented evidence of progress. The project that I've established in regards to this report, I will partner with FISH, the food bank, and provide education and wellness exams to clients receiving their services. So it's kind of been, I'll kind of walk you through it. We've expanded it a little bit to some different things. So the intervention activities that I've undertaken. So Tuesday is the day of each week that I am not working in my hospital. It's my day off. So that's the day that I spend working with food banks. Normally the mornings are when the pantry needs to be restocked with a variety of food items that were diminished yesterday's client shoppers come in and they get to choose what they want. So we go in and restock as best we can with what we have available and get the shelves looking good so they're appealing. It's a team, take a quick inventory assessing the needs, get the appropriate groceries, and adjust the volumes. Around 10:30, I leave the pantry and I go to the Calvary Baptist Church, which is one of our community resources that has been very beneficial. And there, the ladies are preparing the food. The church allows us the opportunity there, but FISH volunteers are preparing the food that will be delivered with their Meals on Wheels program. I'm one of the drivers, and whatever route needs to be covered for that particular day, jump on that. Sometimes it's the same one, but occasionally someone's not able to make it. So upon receiving the route and the client list and the allotted hot meals, the next 2 hours, roughly, are spent delivering meals to these individuals. Now, the typical client, as you may imagine, are elderly. They're living alone, possibly disabled, and they are desperately in need of this assistance. They don't have anything else, and nobody's coming to visit normally, so they're reliant on this service. Something I have provided, since I'm a registered nurse and can do it, is to perform a wellness check on them, and this is simply to assess whether professional support might be needed by a medical professional, or law enforcement. Maybe there's some sort of a safety concern that I see. So have a short conversation with them, look around, um, you know, and just kind of make an assessment there. After satisfying this segment of the itinerary, the next several hours normally are going to be spent back at the fish pantry, where there again, every afternoon, client shoppers come to make their food preference choices. At this point, my role for this project will change, and I'm helping to provide an educational resource to these folks to make healthy decisions based on their nutritional value of their selections. So, for example, saying, well, maybe not as much soups and canned items, um, because of a higher content of sodium, which is not very good for you. Kind of educate them, getting, maybe some fresh tomatoes and make your own pasta sauce, fresh pasta. I don't know. Certain things like that I try to help them out with. And a proper evaluation for the evaluation segment of the activities performed to provide these services is necessary, something that we have to do to determine if this project has been successful. Now, of course, this needs to be accomplished on a continual basis so that adjustments to the process can be made if they're required. One method concerning this project would be to simply reach out. One method of evaluating, reach out to some of the actual client stakeholders, ask them some basic questions about their level of satisfaction with services that are provided. Keep an inventory, possibly, of some of the least healthy choices of food. There again, items high in sodium, processed foods, and this way we can help determine if after the education, some of these things are selected less often. To remain consistent and engaged with the stakeholders, timely communication is required between the project coordinator, which would be, I guess, me, and the members of the fish management team. If this is done correctly, adjustments to the process can be made quickly to provide the level of service which was intended from the beginning. Okay, guys, hang in there. We have reached the conclusion of this presentation, and so I want to see what have you learned, is the way I've described it here. So I'll tell you, in this report, you have been provided with a very inclusive description of one small northwestern town located in the shadow of the Cascade Mountains of Washington State. Very beautiful here. Information has also been included that explains what amenities this particular city is able to make available to positively impact the residents' lives. I have included a formal nursing diagnosis that is associated with a certain, um, not a small, it's a pretty good size segment of this population that has allowed you to understand the motivation behind the clinical objectives that I chose. I have given you a thorough presentation about the structure and the resources available to the fish community food bank, where my clinical component has been established and carried out. And you have also learned about the particular aspects of this project that not only make it beneficial for the client, but also necessary to improve the quality of their lives. I have provided you a detailed conclusion that incorporates what specific information has been given so that a clear understanding as to the scope of the project. Attached to this report, a couple of things on my appendix that will give you some statistical data I told you about this earlier, helped you define the community and individuals that are involved in the venture. Finally, included will be a reference page that provides all of the information that I've used to document this project. Thank you for your listening, and I value your feedback. So, excuse me, this slide will just give you just a little bit of statistical data provided by citydata.com, a wonderful resource. If you're not familiar with it, you should check it out. Basically, it shows on the left side the races in Ellensburg, the purple being the Caucasian, and then is, all these little bitty segments of society: Hispanic, Asian, two races, Black, American Indian, Native Hawaiian, that provides the diversity. Now on the right hand side, you can see this is the breakdown of poor residents by race. So there again, you can see this is our 50% mark here. Well, you can see it. I don't think this pointer works. But for example, Asian and Native Hawaiian, these are very small, 3% and 0.5% population of this little community, which is only 22,000 people. So it would be very easy for these poor people that are living below poverty and are such a small percentage of the race. They're not a minority, or they're not a majority at all. So it'd be very easy for them to get lost. So that's why I want to take this project on. Thank you for paying attention, and for those of you that didn't wake up, and following will be a list of all the resources and references I used, and thanks again. Good luck with everything.